Hi, Dr. Ken Pinnell here, coming to you from Pinnell Chiropractic, your Cranberry Township, North Pittsburgh Chiropractor. This evening I'd like to go over some exercises that we recommend for our patients that have hip pain. And the hip joint is what we call the ball and socket joint. It's comprised of the head of the femur bone, the long bone in the leg, as that attaches up into what's called the acetabulum, the hip socket, in the pelvic bones on the right and left side. It's a very movable ball and socket type joint, and one that is oftentimes a very common source of pain that we see in our patients coming into the office. And some of the causes of that pain could obviously be if somebody has an arthritic or degenerative hip, that could become inflamed, very stiff and painful. It's also commonly found in people that have a very noticeable pelvic tilt, where one side of the hip and pelvic region is noticeably lower than the other when standing. That can be caused by one leg that's shorter than the other, and that can really throw off body weight, where someone might be carrying a predominant amount of their body weight on one side versus the other, where ideally you want to carry 50% of your body weight on the right and left sides. If somebody's carrying, for example, 75% on that right side, that would really stress load that right hip joint and could lead to some pain and stiffness in that joint. Another very common cause of pain through the hip is because of what we call tight hip flexor muscles. Hip flexion is bringing the knee up towards the chest, and for people that sit all day at their jobs, those hip flexor muscles can become short and very stiff and tight, and when that happens, that can pull the hips forward, puts a lot of strain on the hamstrings, and can really result in a lot of pain through the hips and the lower back. Now, a real easy way to determine if you have tight hip flexors, if you're unsure, you can perform a test at home that is one that we use as part of our normal physical examination for the hip, and it's called Thomas test. And to perform that test on your own, you would just lie down on your back, and in this case we'll be testing the right side. You'd want to bend that left leg up, and you'd want to pull it up towards the chest. And if that hip flexor isn't tight, that leg will stay nice and straight as you pull that up. And in my case, my hip flexors are pretty loose, so that leg's staying straight. If that right hip flexor was really tight, as you're pulling that left knee towards the chest, that tight hip flexor muscle would pull the knee up off the table. So as if as you're doing that, you feel that knee come up, or you can have a friend or a family member watch as you do that. If that knee wants to pop up, that would mean that hip flexor muscle is tight. And you can do the same thing on the other side. As you pull that right knee towards the chest, that left knee would come up off of the table. So while I'm on my back here, one of the exercises we recommend for the hip region is what we call the knee to chest exercise, where you kind of pull that knee up towards the chest. You want to hold that for a few seconds, let it relax. Do that again, hold for a few seconds. You want to try to do that 10 or 12 repetitions, and you do that on both sides, 10 to 12 repetitions. Pull the knee towards the chest, let it relax, pull it back up. Try to do that 10 or 12 reps. Now, one of the common motions, multiple motions that we see restricted in people that have arthritis in their hips or tight hip flexor muscles, just tight hip joints in general, is a motion of combining flexion, abduction, which is to take the leg away, and then what's called external rotation. And a real easy way to work that motion into the hip joint is to just bend that opposite leg up, kind of cross your ankle and foot over that other knee, and then just kind of passively push that knee down, and you'll get good motion, stretch in all three of those, the flexion, abduction, and external rotation. If you wanted to get a little extra motion, you can pull that opposite leg up and push down, and you'll really feel a good stretch through that hip joint. It's just kind of pull up and push down. And we want to keep this below the pain threshold. If you're starting to do that and you feel some pretty sharp pain, you don't want to push it beyond that. But good way to get some good motion and stretch into that hip. Another way to do that, an alternate way, would be to kind of bring the legs up cross-legged, sitting Indian style, and then just kind of with your elbows push those knees down towards the table, and you'll feel that same stretch through the hip flexors, and you'll get that motion back into the hip. If you wanted to get a little extra motion as you're pushing down, just kind of bend forward and hold that for a few seconds. And you want to do that about 10 to 12 repetitions. Once again, if you get to repetition 4, 5, 6, 7 and you're starting to feel pain, don't push that. We want to keep that below the pain threshold. Now the final exercise, and I'm going to demonstrate that up on the table, you can get down on the floor to do this, is a really good stretch for that hip flexor muscles if those are tight, and even if they're not, it's really good to stretch out those hip flexors on a regular basis. So the way we would do that is we would get on the knees, and if we're going to exercise this left hip flexor here, you would bend the other knee, put the foot on the floor, and as you're bending forward, you'll feel a really good stretch through that left hip flexor. And you want to hold that for a few seconds, come back up, bend back down, really stretch that hip out. Once again, don't push beyond that pain threshold, but you want to try to get about 10 to 12 repetitions. Now, if you wanted to isolate that even further, what you can do is kind of pull the leg, that left leg and foot up off of the table, and do that same thing, and you'll really feel that stretch even down into the quadricep muscles. So you want to do that about 10 to 12 repetitions. Then you repeat the same thing on the opposite side. So if you do those on a regular basis, I think you really find that helpful for relieving hip pain, getting some good exercise and motion into the hip joints. If you question whether or not you're capable of performing these exercises, certainly consult with your chiropractor or family doctor, a qualified medical health professional, and they'd be able to let you know if it's okay to do those. But if you have any questions on these exercises, feel free to leave a comment. If you'd like to see us do a video on a particular subject or a certain group of exercises, feel free to comment and we'll be happy to do that. Like us on Facebook, subscribe to our YouTube channel. If you'd like more information about our office and the services we offer, you can find us on the web at www.pinnellcc.com. For now, this is Dr. Ken, your Cranberry Township, North Pittsburgh Chiropractor. Until we talk again, thanks so much.